Good morning, everybody. We are down here at the hospital for Montana's exam. Anybody want to guess how much he weighed? I'm sure everybody here's back could tell you. 444 pounds. So we did Dr. Kellyn did an overall exam, but the procedure that we did was he had a mass. Yeah, so she did a tumor removal. And he is 14 years old, came from the Colorado project back in 2016. Getting some more suture. A tumor like this, you needed to get a lot of margins, so sorry if there's some blood.
Yeah, and it was a very circular tumor also, and you can't close the circle, so you have to even get bigger margins because of that. So it wasn't quite as big, but the scar will look a little bit bigger.
And we'll be sending that off?
Yes, for sure.
And your thoughts is possibly a mast cell?
Yeah, just because the tumor it was definitely angry on the outside, so it wasn't like a nice kind of sub-Q, the skin's covering it type mass. It had ulcerated, so it was very irritated and inflamed and oozing blood a little bit. And mast cells, what they do is they release histamine, which is what causes a lot of bleeding. And so a lot of times with those type of skin tumors that we see, if they're mast cells, a lot of times they will ulcerate out because of that amount of histamine that's in those cells. So, but it still could be, there's still plenty of other, unfortunately, most of them are bad type of tumors. But bad skin tumors are kind of the best type of bad tumors you can get, because most of them are very slow to metastasize if they're going to at all. So. And
probably also that's why your incision is bigger, because you want to get margins.
Exactly. Yes.
Yeah.
For sure. Make sure that it doesn't come out.
It's in this little jar here. Will be sent out. We'll go up here where Lori is. We have the monitoring on him. He's doing pretty good.
Yeah. And otherwise seems super healthy, so hopefully this is not a big deal type of tumor we're removing.
And this is the large animal anesthesia?
I guess back disease.
Oh, right.
Yeah,
so
very bad spine.
You did some radiographs and...
He's already was started on pain management because you could physically see the arch to his back, but he started to get some muscle atrophy, which was telling us that he just wasn't moving as much as he used to. So he's been on pain management, he's been on joint supplements and all that good stuff, but it's nice to be able to document the state of the arthritis that it's at, and so that way in the future, if he starts to slow down even more on us, we can always view that progression and make choices based off of that. So.
All right. So if you're just tuning in, we are down at the hospital with Montana, 14 years old, 444 pounds. Had a wellness exam, but also a tumor mass removal. Dr. Kellyn's just finishing up with that. And now I just see a whole bunch of stars coming in, so thank you very much for that. And we will be doing some sutures, and you're going to do some staples, so we'll have to go in and remove.
Yeah, staples tend to be a lot less irritating, so the animals leave them alone more. And since this is in a perfect spot for him to groom, we're hoping to decrease that behavior by doing more staples than sutures. Sutures get really itchy, so.
And so when will we be going back in?
Probably in about 2 to 3 weeks.
All right.
It'll kind of depend on him, I think, too.
And he's going to stay down at the hospital for now. For just how long are you thinking?
And I think it'll probably depend on him. I was hoping to get maybe just like 5 days in for this to really nicely close up.
Yeah.
And stay clean. But if it looks better earlier, maybe earlier. If he keeps messing with it, maybe later.
They just don't make cones that big, huh?
No.
Thanks everybody for all the stars. We'll go back and take a look at Montana again if you just are tuning in. So he had a wellness exam. And Jade, why don't you show me those feet? 444 pounds. How much you think 1 foot is, Jade?
Enough.
And
Compared
you
to
guys,
my hand.
you already trimmed the claws?
Got a little bit of a claw trim.
All
Still
right.
pretty big.
Put your hand up there again.
Next to that, on the other side.
It's a big foot. It's a big cat. We all were guessing he was about 500 pounds or more. After we lifted him, we said even more. And then, so 444 is pretty good.
Yeah. Did you tell him what he had previously weighed?
No, it was, yeah, when we rescued him, he weighed 587 pounds. So he's at a nice weight. He was definitely obese. We don't want them. Obese can be just as bad for their health. Well, thanks everybody for tuning in. If you just got here, remember you can replay this. Thank you so much for all the stars and joining us here at the hospital with Montana for his exam and tumor removal. And we'll keep everybody posted. We'll send that out and usually get results back in about 10 days or so. We appreciate your support.